Week's Facebook Live. Today I'm going to go back to my roots, and we are talking about persistent or depressive disorder, and we are just dealing with notifications on my computer. Sorry about that. So we're going back to the roots, because I promised I would always touch back on the roots of raising awareness about mental health and disabilities, and that's what this week's blog is about. So if you're interested in this disorder, then you can find out the sign, the symptoms, find out what it is, and then where to reach out for treatment. But also, if somebody else has just been diagnosed, perhaps you don't know what it is a basic information, and it is very basic information, and I would recommend you get more information about any condition that you've been diagnosed with or a loved one has been diagnosed with, so you can get the appropriate help. So basically, persistent depressive disorder, I'm going to call it PDD from now on because it's a mouthful. They say it's less severe than major depression. Now, caveat about that is major depression is severe depression. Okay, there's mild, moderate and severe in terms of depression. Major depression is also known as clinical depression, or it's severe depression. Now, with PDD, it's less severe. That's what they mean by that. So it can be mild or moderate, it can be severe in itself, but they also mean that it's more likely to be persistent. It lasts longer than clinical depression in that it lasts for continually for at least 2 years. So you've got to understand that this is something that can last for years and even longer. So you need to really get a proper diagnosis to get proper treatment, and treatment is very, very effective. It's more likely to occur in women than men, and it may affect children. That's the one thing you have to know about this particular type of depression. It can affect children. It can also occur alongside major depression, like clinical depression. So you can have persistent depressive disorder, and then you will get a bout in between. You'll get bouts together of clinical depression. You'll get a bout of clinical depression. So they can occur, and other conditions, of course, and I'll talk about those in a minute, can occur as well, but you can get the two of them together. The symptoms will be such that they disrupt your life on a daily basis. They are disruptive to somebody's life, and as I said, they do really need correct diagnosis, and this will be a psychiatric diagnosis. It'll be a clinical psychologist diagnosing this, and a treatment. And as I said, please reach out for help, because the treatment is really, really effective. So it will and does help you. So symptoms, as I said, the intensity of this PDD can change. So it can be mild, moderate or severe. So you can oscillate in and out, but you will be there. It'll be always there. Always will be this type of depression will always be there, and it'll have to last for at least 2 years. Now that's in adults. Okay, I'll talk about kids in a minute. And as I said, you can also experience major or clinical depression, bouts of it during that period of time as well. So, symptoms such as, a loss in everyday activities, particularly around social activities, withdrawing from those social activities, persistent sadness, anxiety, feeling empty, low mood, feeling down, and it's persistent. For most part of the day, and it's every day. Inability to concentrate, think clearly or make decisions. That's another symptom. Not enough energy. You don't feel like you have a lot of energy. You feel very fatigued. Or you might hear somebody complaining about feeling tired all the time. They just don't have a lot of energy. Now, some of these symptoms you've got to be watching for. because they can indicate something else, a medical condition, and we'll come to that in a second. Irritability or excessive anger. I mean, it's very frustrating to feel like this all the time. As I said, feeling very hopeless, but guilt, a lot of guilt as well can be in there. Significant weight changes, we'd be looking for a kind of a 5% weight change within a month. So, you know, a plus or a minus due to either not eating or overeating. Changes in sleep patterns as always, and again it impacts our self-esteem, so low self-esteem would be one we would also look for there. The causes of PDD, of course, they're not with most mental health diagnoses, we don't know why they're there. We just really, it isn't, the exact cause isn't there. It's usually, you know, more than one factor that contributes to it. So it could be biological differences, brain chemistry. That means, you know, your brain, something, chemistry in your brain is of inherited traits. Could be genetic. Life event. We've had major life, and it'd be a major life event usually. So major life event, we just had a major life event for most people on the planet with a pandemic. So that's pretty major. Other conditions that can arise that cause complications. So as I said already, major depression or clinical depression can occur, you know, simultaneously with this bouts of clinical depression. Other conditions that might arise would be an anxiety disorder, particularly social anxiety I would watch for there, mood disorders, personality disorders. And I've talked about different personality disorders before. Other factors that can cause complications, substance abuse issues can arise because the person is trying to use, you know, alcohol usually, perhaps drugs, to help them cope with what's going on. There'll be relationship difficulties, family difficulties will arise, of course, and of course, because it can affect children, you know, work, school and college difficulties and work issues can arise there too. So treatment. So let's talk about diagnosis first. This requires a proper diagnosis. So your first protocol is going to be, as always, your GP. And I say that to you because your GP or your main doctor, and I say that because they need to rule out other medical conditions. So they're going to run a batch of tests to run out, you know, to rule out other medical conditions, health conditions that you might, physical health conditions that you might have that could cause the symptoms I've listed. So you've got to go. That'll be the first protocol, and then, you know, if they feel, you know, this is ongoing for the amount of time you've been talking to, they're going to want to refer you to a psychiatrist or a clinical psychologist to get a proper diagnosis, a proper assessment, and they're going to determine whether you have PDD or not. And as I said, they're going to want to determine, you know, if there are other conditions or complications, like, as I said, clinical depression or bipolar disorder or seasonal affective disorder. There are other conditions that could come in there that they're going to want to rule in or rule out, and they're going to want to give you a proper diagnosis so that you can get a really effective treatment program. And as I said, it's very, very effective once you get the diagnosis. Now, the difference between the criteria for getting a diagnosis between adults and children. So with adults, it'd be 21 plus, okay, because that's the way they tend to, with this one, that's the way they tend to, you know, demarcate on this one. So it's, if you're 21 and older, it's called late onset PDD, and if you're under 21, it's early onset PDD. So what they want to do is look at the difference in the criteria. With an adult, the depression occurs for most of the day for the last 2 or more years. With a child, the depressive mood or irritability, this is the difference, the depressive mood or irritability occurs most of the day for at least 1 year. As I say to people all the time, with a child, with a teen, never wait. Never wait. Always step in quicker with a child than you would with an adult. Treatment is usually a combination of medication if required. It's going to depend on your, on the severity of your symptoms and that, and psychotherapy. So in other words, a talk therapy. You're going to go, probably CBT, DBT, it could be group therapy, there could also be family therapy recommended. It depends on your circumstances. There's going to be a whole combination of psychotherapies talked about in there. And as I said, it's going to depend on the severity of your symptoms. Have you had any previous treatment? Did that work? What didn't work for you? And other conditions that might be present. So that will depend then whether you need what you need. Programs should be tailored to you, and you should, if you are the patient, you should always feel in charge, to be empowered. It's very empowering when you're the one in charge, and that's the way it should be when you're that they're designing a treatment program for you with your therapist. So the next thing is some self-help. I always give some self-help tips. The main and the first thing I would say to you is, if you feel you or a loved one has this condition or any mental health condition, please see your main doctor or your GP as soon as possible. You can always, even if the person is an adult, you can always talk to the doctor. The doctor will not be able to disclose anything to you if you are not the patient in question, but you can raise your concerns. They're always happy to listen if you have concerns about somebody. And sometimes it is a friend or a close friend, or a relative that sees things more clearly than the person themselves. As I said, treatment is very effective. So please, once you get a diagnosis, stick to your treatment plan. Your therapist will work out a treatment plan with you. If there's medication required, please take your medication. It's not going to be possibly forever. We've got to get over that. We'll take a tablet for pain, but we get really hung up on taking tablets for mental health. Please get over that. They are really effective if you need them. And it doesn't necessarily mean everybody needs medication. It can be enough that you have a treatment plan with your therapist put in place, and that may be what you need, alongside lifestyle changes. So these are things where you can start taking back power, and making simple lifestyle changes can help. So the usual suspects I'm going to talk about is, exercising, getting out for 10 to 15 minutes, particularly now we're coming into the winter time here. We want to be getting out at lunchtime, eating healthily, 3 meals a day or 5 smaller meals a day, cutting down or out alcohol, because it's only going to make it worse, make your condition worse. Caffeine, of course, and sugar will make your condition worse as well. It does make the symptoms worse, particularly if you've got anxiety in there as well. Quit smoking, the usual suspects as always. But also, we have to find ways to relax, because stress is going to be a big factor here. So, you don't have to do mindfulness, but you can try it, or other forms of meditation, or some other way that you can find to relax. Yoga, tai chi, even swimming. People are running, people can find it very relaxing and very helpful. So you're combining, ways to exercise and ways to relax as well. Other things can be setting yourself some realistic goals and planning, frequent breaks during the day. Pacing is a word you would hear here. Another term I've heard is spoons. It's a very good technique where we only have a finite amount of spoons during the day, and for each activity that we do, we lose a spoon. So you have to think, how many spoons can I give to my day overall, or how can I pace myself out during the day? that, you know, I'm setting realistic goals, and therefore I'm not putting myself under stress, and I'm not pushing myself. And we need to really realise that we need to, you know, give ourselves a break and not be pushing. We need to take the, you know, take the speed off the car and kind of go, okay, we need to slow down here and start looking after ourselves. So other things you can do here to help yourself is, you know, make sure you're aware of your condition. So reading about your condition, understanding it, is going to help you better. Joining a support group is vital, because listening to other people who have the same condition or similar conditions can help boost your self-esteem, as well as, you know, feel somebody actually knows what I'm going through. They understand me. They get it. They absolutely get it. The other thing I'd say to you is you're going to need that positive team of supporters, and I've done a whole video on that, because we need 4 types of support in our lives every day. Every single person does. So we need that team there, and to get them involved with our recovery plan. As I said, you know, your therapist will help you with a recovery plan. And that'll help prevent as well relapses. So, you know, getting these team of supporters in there, not just your friends and family, but your GP. Maybe you need, you know, some financial support. So, you know, knowing your rights and entitlements, getting financial support, understanding legalities around, you know, workplace rights and things like that. The other thing I'd say to you is please don't self-medicate with either prescription or illegal drugs. It's only going to make things worse for you. Also, know your triggers, know your warning signs. It's very important. Again, this would be part of your recovery plan with your therapist, knowing your warning signs or triggers. And then, you know, you'll be able to put in place with the therapist daily strategies. Not just the lifestyle changes I've talked about there, but there are other strategies that we would use in CBT or DBT that can be put in place to help you, you know, with this recovery plan on a daily basis, and deal with the triggers, so you don't fall into traps of a trigger. The main thing here, I think, for self-help is to be very patient with yourself. You know, your recovery is going to take time. So please try and focus on the positives, on how far you've come. Activities that, you know, will make you feel better about yourself is avoiding the isolation and getting involved back with that positive team of supporters, your friends, your family, doing activities. Because depression in particular will want you to isolate yourself. And with this type of depression tends to come a social anxiety. So you will want to isolate yourself. So you're better off engaging with these team of supporters, and, you know, doing activities with friends and families that are positive for you, not negative vampires, please, that will help you in your recovery and help, you know, eliminate to as much as possible the isolation that can occur with this. And as always, just to finish up, for people that are supporting others with PDD or with other forms of mental health or even disability, you know, you have to remember this is hard. It's very hard on them, but it's also hard on you, if you're the carer, or even if you're just a family member or friend, a close family member or friend there. You need support too. So there are things we need to be aware of. You might need your own therapy yourself to get support. You might notice that, you know, there are relationship difficulties with this person. The relationship can become strained. So talking to somebody is very good, or also talking to a support group, your own support group, can be really good. If it's a marriage or a partnership, again, it can take a knock. It can really take a knock. Or if this is your child, it can take a knock. So consider therapy, consider couples counselling. Just because the person has a mental health condition, or you know, they have a disability, doesn't mean they get off doing marriage counselling. they can still go to marriage counselling, and you can work that out. You can work that out with the therapists involved. Again, as parents, you need support too if this is a child. The other thing I say to you as well is usually it falls on the partner. If it is a partnership or a marriage, that they are the ones that are left, dealing with a lot of the doctors, a lot of the financial responsibilities and that. So again, a therapist is very important for this. It's she or he is a sounding board for you to talk. Group, as I said, a support group is also a vital line for information. To understand your rights and your entitlements, including financial support you might need. But also there are groups in Ireland that can help you here. So MABS, the Money Advisory Bureau Service, Citizens Advice are always good. The Department of Employment Affairs and Social Protection, they are in Ireland, I'm afraid, but there will be similar organisations wherever you're living, so you can check those out. The only thing I'd say to somebody supporting someone with depression, it can be very stressful. So again, you need to be looking at ways to reduce your own stress. You need to be looking at ways to relax, to exercise, eat healthy, take some time out, and that can cause an awful lot of guilt within us. Again, your therapist will be able to help you with this guilt. It's important you do take breaks. You can't just be on the front line all the time. You need it, and it isn't unusual or unheard of for when one person gets better, the other person that has been supporting them to get sick, to get ill. So it's important you want to stave that off, that you want to be reducing your stress and getting every bit of information you need, and make sure you're covering all your rights and entitlements, but mostly stress reduction. If you need a break, you need to be pacing as well, just as much as the other person. So as always, I will leave it there. Thank you all for listening. Thank you for listening to those that listen. I know there's an awful lot of people that listen on replay, both here on Facebook and on YouTube, so thank you very much for doing that. I will talk to you all again next week. I can't remember what I was going to talk about. I think it's self-confidence I'm going to be talking about next week. It's already scheduled and posted, so it's completely gone out of the head. Facebook has changed the settings, so I can't see who. I know people are watching because I can see the numbers are up, but I can't actually see who's actually watching. I see. No, can't see. Sorry, I can't see. So I leave it there. Thank you all for watching. Thank you all for listening, and I will see you all again next Saturday morning. The new blog is out on Monday as usual. If you can't wait until next Saturday, do check it out. And I will talk to you all soon. Thank you very much.